So my name is Bobby French, and I'm a child and adolescent psychiatrist in Halifax, and I have had positions in many areas of the IWK, most recently in the emergency department and also in the inpatient unit. And I think it's important that people understand that mental illness starts in childhood and adolescence, and that a common stat among our group is that about 1 in every 6 kids who actually needs mental health or psychiatric help gets that help. There's a lot of reasons for that. Underfunding is the biggest. Lack of understanding that children are acutely psychiatrically ill. I go to a cocktail party, people say, "What do you do?" "I'm a child psychiatrist." "Oh, so you deal with behavior," or "Oh, what is it you do?" Or if I'm on call or in the emergency room or up all night, what emergency could you possibly have? And people forget that we have kids who have schizophrenia that starts at age 15. We have bipolar illness, we have major depression, we have suicidality, we have eating disorders. We have a full range of mental health concerns that are very, very significant in this age group. If we do not put funding and research and resources into this age group, we are lost. Because if kids don't get intervention, they're going to be psychiatrically unwell adults. This is our problem here. We are focusing on early intervention, preschooling, and things like that. We need resources now for these kids who are sick. We've got over 1,000 kids through the IWK emergency crisis room last year alone. We really need to get it together around a strategy. We need a national strategy for children and youth psychiatric illness, and we need a provincial strategy. And then we need a strategy for each district throughout the province. We are continually trying to do 110% with 75% of resources. We need to get our own house in order about what services we have to cut in order to provide reasonable services currently. So what I'm saying is that if we really want to do a decent job of providing care for these kids now, we have to cut out some of what we're doing, and that's because we don't have enough psychiatrists. It's a tough job. There's a lot of stigma around being a psychiatrist. We're underpaid compared to our Royal College colleagues. For example, if you're a radiologist, you can make twice what I'm making. So on every sort of level, we need to look at recruitment, resources, psychiatric nursing in youth. I mean, all these large issues. It's a big project, but if we had a national strategy and a provincial strategy, I think we'd be able to do that. I think we need the public's help. We need public to understand these kids are just as sick and just as important as the kids with cancer and the kids with diabetes, and they get forgotten. I know you'll see the IWK telethon. I don't know how much mental illness gets on the telethon. So the stigma issues I think are even larger in children and adolescents. And so when you combine lack of resources, lack of funding, lack of strategy, stigma, and general public misunderstanding, you're going to have a large problem. Most recently, the previous health minister, Karen Casey, it was written in the paper, word for word, that she said there is no crisis in adolescent mental health care. And I almost fell off my chair, because I'm thinking, I'm in the emergency room, I'm in crisis with these kids. I get 1,056 kids coming through. Where is government? Why does government not understand this crisis? And we are in crisis. There's no debate. I think we need to figure this out and figure it out soon. If not, as a nation, in 10, 15, 20 years, we'll pay the price. So if government could get on that and understand intervention now will save money later, and public can get behind that, I think we'll be in a much better place.